Hey everyone, this is Larry Huppin at ProLab Orthotics. We're going to get started in just a moment. Um, and if anybody has any questions during the webinar, go ahead and throw them into the chat and I'll get to them at the end. And I think I'm just going to, I think it's 2 o'clock almost. And also we'll have a chance to talk if anybody wants to ask a question verbally, you can raise your hand at the end and I can unmute you. So I'm going to turn off my video now. It's 2 o'clock exactly on the West Coast, and we'll go ahead and get started. All right, so here's what we're going to talk about today. It's what I like to call the at-home or the online biomechanics and orthotic therapy fellowship. Basically, what is out there for you to learn biomechanics and orthotic therapy that you can do if you didn't get enough in school or you don't feel like you're at the level you should be. Now, for those of you that attended the seminar last week, the webinar last week, we went over some basically what I would call modern orthotic therapy and biomechanics. And as I've said previously, this is something that is taught in other countries extensively, unfortunately not taught a lot in the United States. Just real briefly, myself was told previously I wasn't doing a very good job of telling who I was, but I graduated from CCPM back in 1988. I was very lucky to do a fellowship in podiatric biomechanics. It was an interesting program. It was a program that created over a couple generations a lot of the educators in orthotic therapy and in podiatry. Some previous fellows had been Ron Valmassi, Rich Bell, Richard Blake, and Kevin Kirby, just to name a few, but really created a whole generation of educators in biomechanics. And this fellowship ended back in 1999, and I think that's one of the issues is we're not really creating any new educators in this area. I do practice, I have a private practice in Seattle where I specialize in orthotic therapy. I've worked for many years as medical director at ProLab, and I used to teach at CSPM. I want to dedicate this to Paul Scheer. For those of you that don't know Paul or didn't know Paul, we lost Paul about 1.5 years ago. But Paul, along with being the founder of ProLab, was a really unique individual in podiatry. He was a former head of the biomechanics department at CCPM. He's the youngest dean, I think, in podiatry history. He came directly out of his residency and became dean of the California College. Probably one of the most, if not the most successful businessman in podiatry, but really his passion was education, and particularly education in biomechanics and orthotic therapy. And in the last years of his life, the thing that Paul probably focused on more than anything was how to bring this type of education back to podiatrists in the United States, as it was something that we were really sorely missing. I wish he could be part of this. I think he'd be excited about what is now available out there, but I always keep Paul in the back of my mind when I'm talking about what we're going to be talking about today. I really don't need disclosures of this. Obviously, I work for an orthotic lab for ProLab, but this has nothing to do directly with ProLab. So this is the irony here, is that we know a lot more, and when I say we, I mean the world in general, we know a lot more about orthotic function and foot function than we ever have. But unfortunately, in the United States, there's far less time devoted to biomechanics and orthotic therapy in the podiatry schools. Most, if not all, podiatrists now go on to 3-year surgical residencies, and most have very minimal biomechanics and orthotic therapy in their residencies. New practitioners in particular have very little exposure, experience, or knowledge when it comes to biomechanics and orthotic therapy. There's minimal CME hours devoted to modern concepts in orthotic therapy at most meetings. And there's really a fairly low percentage of sophisticated orthotic practitioners in podiatry in the United States. Now that's very different in the Commonwealth countries, in Australia, New Zealand, UK, for example. They're much, much more sophisticated than we are in general. In fact, I would call this a golden age of education in this area as far as the availability of that education goes. And as I say here, I mean, many countries, podiatrists are practicing orthotic therapy at a much higher level than we are. And I think the best online education in podiatry right now is focused in biomechanics and orthotic therapy. As I noted, most of that does come from the Commonwealth. And there are really quite some exceptional values. I mean, you can really make yourself an expert in orthotic therapy quite inexpensively using online resources. I say that this takes about 3 to 6 months, probably a little bit less right now, as you might have a little more time at home, some dirty dishes, a commute, and somewhere between about $400 and $1,500 to really understand where we should be in orthotic therapy in this country. So I'm going to talk today about 3 to 4 online courses, one of which I think is critical. A weekly video update on foot biomechanics research, to actually 3 podcasts. I just added one this week. 3 podcasts, a set of books, a content curation website, and an online forum. I think with this information, you can really become an expert. This is my kitchen, and this is where I actually watched some of these courses. You can see my phone right there, and my wife kind of loved this because I was doing dishes every night, going through these courses, and I spent about 20 minutes a night over a few months, and a few years ago, really, I think dramatically improved my ability to treat my patients by bringing much of this information into my practice. And I thought I was doing quite well up to that point, but there was some stuff that maybe was not new, but that I was not using to its extent, and a lot of information I found that was brand new to me. So this is where I want to start, is on the courses. In particular, this one I have in purple here is the Clinical Biomechanics Bootcamp by Craig Payne. Craig, I think, is probably the best educator in orthotic therapy out there right now. He is a former senior lecturer at La Trobe University in Melbourne. He calls himself a university lecturer, a woo basher, a runner, a cynic, a researcher, a skeptic, clinician, rabble-rouser, and a dad. And he is a very evidence and science-based educator with some just amazing information that he's put out there. I think this is really key. He talks a lot about science-based medicine, not necessarily evidence-based, but always science-based. I just want to check something here. And it basically, what he means there is use the best possible conclusion that science currently has to offer in making clinical decisions. And I mean, if there isn't evidence per se, he can go back to basic science to help make these decisions. So it certainly includes the best clinical studies possible, and also considers preclinical and basic science, and takes all the information available from science that can be reasonably applied to whatever the question might be at hand, basically to come up with the best potential clinical outcome for your patients. Here is just a portion of the curriculum. I've just put in red some of the areas I think that are most important. But first part goes over evaluation. Let me back up a little bit on this. So this course is probably about 30 hours long, I would say, in total, usually in about 15 to 30 minute blocks. Most lessons are about 20 minutes long. So for example, he talks first about the foot orthotics paradox and the solutions to the paradox, goes over evaluation, then goes into the theories of how feet function and how orthoses function. And it looks at the advantages and disadvantages of each of these theories. He looks at defining orthoses, prefab versus custom versus library, looks at negative model production, casting, laser scanning, everything else in between. Design features of the orthotics themselves and when to use them. He looks at specific pathologies and how to write orthotic prescriptions for those. Spends a tremendous amount of time on research, has a section on running specifically, and also spends a lot of time, if you look number 65 over here, It has a whole course in this also, but critical thinking, skepticism, and logical fallacies when it comes to medicine in general, but specifically here to orthotic therapy and biomechanics. Along with the course, you also get a lifetime subscription to what he calls his weekly CPD Bootcamp. CPD is continuing professional development. That's what they call, what we call CMEs. This is a weekly video, well, anywhere from 10 to 30 minutes long, on the research that's come out in the previous week having to deal with this area. And he's very good about evaluating the research and talking about what makes sense and what doesn't make sense, what's good and what's bad. I think that's the most important course. He has some other great courses too. I certainly, if you have time, I would take all of them. The Critical Thinking and Science-Based Podiatrist Bootcamp and the Running Shoes Bootcamp. And I heard rumor, I can't remember where I heard it, but he might be doing a sports medicine bootcamp coming up here. Another course is Bartold Gold. This is by Simon Bartold, another Australian podiatrist, currently, I believe, working in France for Solomon. But he has 4 musculoskeletal injury courses: plantar heel pain, Achilles tendon pain, shin pain, and anterior knee pain. So if you're looking for very up-to-date information on these 4 pathologies, I think this is a great place to go. Simon is also a great educator. I'm not as big of a fan of this course. It's got a little bit of video, but most of it is reading, and I really like to multitask. So this is something I like to do with video personally, but if you'd rather read, this is also, I think, it's great information. And again, here's the areas that he currently covers. And here's just some of the, this is just the Achilles tendon pain, the different lessons in Achilles tendon pain. So again, a very, very complete information on these pathologies. If you're interested in mobilization, and I spelled it here the Commonwealth way, just because that's how he spells it, but Ted Jedinak, another Australian, does a really good job. I've just started this course, so I can't give you complete information on it, but if you have interest in mobilization, this is, I think, probably the best course to go to. There's also some fairly good information on mobilization just on YouTube by both Ted and by Howard Dannenberg. If you have an interest in children's podiatry, here's an online course by, again, 2 Australian podiatrists, Kylie Williams and Alicia James. Both are PhDs, and I know Alicia, I believe, did her PhD just on calcaneal apophysitis. So she knows a lot about calcaneal apophysitis. So I have not taken this one, so I don't really have any feedback on it, but it is out there if anybody has interest in looking at it. So if you just look up this website, Children's Podiatry, and look up maybe either Kylie or Alicia's names, this should pop up for you. All right, so those are the courses that I've currently found, and I think I would recommend looking at. But the one that I think is absolutely critical is the Clinical Biomechanics Bootcamp by Craig Payne. So next we have a few podcasts that I think are great to listen to if this is something you're interested in. I put the traffic up there because there used to be traffic and there used to be a commute, and this would be something you could listen to during that time. First one is by Ian Griffiths, and again by Craig Payne. It's called Pod Chat Live. It's an exceptional podcast. And they interview some of the top minds in biomechanics and orthotic therapy, and I've just listed a few of those here. They just recently, I think just last week or last couple weeks, did one with Richard Blake. I'm about halfway through that. It was really interesting. They've been doing they did it for a year, and I think 2018 they did one per year, or 2019 maybe they did one per year, and then they started doing one per month, and then with everything going on, they're back to doing, I think it's 2 a week right now, but there's some really great information out there, and you can get this info from the people that are out there doing the research. Great interview with Steven Subotnick on the beginnings of podiatric sports medicine. Alicia James on a calcaneal apophysinus, Simon Spooner on foot orthotic dosing. Very interesting topic. Craig talks a lot about that during his course. With Howard on sagittal plane theory, Bruce Williams talking about plantar pressure. Again, there's all kinds of great podcasts or episodes that they have out there. So I would highly recommend looking at PodChat Live if this is stuff that you're interested in. A brand new episode recently on the supination resistance test, which is what we talked about in the last week's webinar. Ben Boschel is a UK podiatrist, has a podcast called The Heel Pain Expert. And he essentially, every episode, he just takes an article and does a literature review on that article having to do with heel pain. So I've learned quite a bit from him. It's a good way to go through the literature. It's fairly new. I think there's less than 20 episodes right now, and it's a bit sporadic when he brings them out, but I think it's a good podcast. And then one I just added, brand new, called RPM Squared, RPM2. This is primarily on sports medicine. It is for American sports medicine podiatrists, Rob Conanello, Paul Langer, Matt Word, and Michael Chin. Some of the, I think, really best sports medicine podiatrists in the country right now. And they're only on their 6th episode, but there's a lot of good information that they are now putting out there. So those are the 3 podcasts I would recommend. Again, it's the Heel Pain Expert, PodChat Live, the Heel Pain Expert, and RPM Squared. And you should be able to find all of those on whatever podcast player you use. Next, there's a couple books. I think if you want to go old school, you can look at, certainly I think Kevin Kirby's series of 5 books. So Kevin has worked for an orthotic lab called Precision Intracast since I guess the early 90s, late 80s. And he's written a newsletter for them every single month since he started working with them. And they've compiled those into 5 volumes now. And those are available at Precision Intracast. Their website is dpmlab.com. But they're excellent, great references. And then back in 2011, Paul Scheer wrote a book called Recent Advances in Orthotic Therapy. He basically took 10 pathologies and looked at the research on the best research available on how to write orthotic prescriptions for each of those pathologies. And that is kind of funny. I went to look for this on Amazon. This is what I found. I had 2 copies, one at about $600 and one at about $1,200. Although if you notice that the $1,200 one did have free shipping. However, if you just go to the ProLab website and then go to education and look for orthotic therapy book, you can actually buy it from the publisher for $130. There's a link to the publisher there. Finally, we get into curated content and forums. Simon Bartold, along with his course website, has a second website called Bartold Clinical, and this is a membership site basically. It's, I think, $16 a month, and what he does is he takes the research that's out there, articles that are out there, and curates them. So he does a little bit of editorial content at the same time. This is just a sample of what's out there. There's a lot of really good information on this site. And then finally, we have Podiatry Arena, which is a forum. Ian Griffiths and Craig Payne moderate it. And you will find some of the best biomechanists in the world arguing everything from general to the most esoteric points on orthotic therapy and biomechanics in there. So if you want to see what the way they're thinking about this, this is a great place to go. But the other thing it does is it does content curation on literature on specific topics. So you look at this NewsBot one here. This is running shoe reviews or muscle strain on plantar fasciitis. That might be there might be several years worth of just articles that have come out on that particular topic. So here might be what I would think would be a good way to do your online fellowship. Definitely the ones in bold are the ones I think are most important. I would definitely do the Clinical Biomechanics Bootcamp. I think it's a very good price. It's about $400 for lifetime access. And he does update it periodically and adds on new courses or adds on new lessons. With that, you get a lifetime access to the weekly biomechanics research update, again, by Craig Payne. And then of the podcasts, I think the PodChat Live is the most important one to listen to, although I like the other two a lot also. The Bartold Musculoskeletal Injury course, if you'd rather read than see video, then I think I would certainly look at that. But it's also a very good resource just to have available. And again, it's not that expensive, and it's $300 lifetime. Then I would think about doing Craig's other workshops or other courses. The running shoe boot camp would probably be in the next one, and then strategic thinking boot camp. And if you have interest particularly in pediatrics, I'd love to hear anybody's feedback if they do the children's podiatry one. And then there's the Heel Pain Expert podcast would be a good one. And I haven't updated this page with with Rob Conanello's podcast. And then as far as the references, just what we've talked about is down there. If you have any questions, you can email us or at cs@prolab-usa.com. It's customer service again at prolab-usa.com. And then these are also a couple, some good Twitter feeds that you might like. Sports Podiatrist is Ian Griffiths, Simon Bartold, Kirby's I think is really good, and Craig Payne's. Kirby in particular also has a really good Facebook page, but he'll link to all of anything new on Facebook through his Twitter feed. So that is all I have. Let's see if I have a question here. I had a question. Do I know of any biomechanics fellowships available in the USA? The only one that I know of active right now is at Virginia Mason Medical Center here in Seattle. The director is either Eric Height, H-E-I-T, or Mark Reeves. I think if you just look for Virginia Mason it's actually Sports Medicine Fellowship. The Virginia Mason Sports Medicine Fellowship, that will come up. It's really not a pure biomechanics fellowship or orthotic therapy fellowship, but Mark Reeves is very involved, and he is an excellent orthotic therapy educator. This also is a surgical fellowship. There are other sports medicine fellowships. I don't think most of them have a tremendous amount of orthotic therapy. Amal Saxena in Northern California has a really well-respected sports medicine fellowship, and that might be one to look at. I don't know how much orthotic therapy is there. All right. I don't see any other questions. Anything else? All right, if you guys do have any questions come up, again, you can just email us at cs@prolab-usa.com, and we'll get back to you. This is being recorded and will be posted on the website sometime fairly soon. All right, everybody, stay safe, stay healthy, stay sane, and I don't know what it'll be next week, but we will have another webinar in the next week. Actually, really quick, I think in about 2 weeks, hopefully in 2 weeks, we're going to have Tim Ganley, who is a friend of mine that owns an orthotic lab, is a podiatrist in Auckland. And as I said, a lot of these Commonwealth podiatrists are really, really good. And in New Zealand, podiatry is, I think orthotic therapy and podiatry is very sophisticated. So Tim has a lot of really good information. I would really, if you can make that, definitely make it. And Next week will probably either be myself or Diane Mitchell might be lecturing too. That's it. I'll see you guys hopefully next week.